Good afternoon, everyone. And welcome to the sexiest topic. So as said, my name is Desiree Mearns, and I'm the director of both the SHINE program and the benefits enrollment for your area agency on aging. I'm going to throw a lot of acronyms at you. I'm going to talk about all Medicare basics. I'm going to try to limit what I have to say to 30 minutes and provide 30 minutes for questions, because I know that's really what you're here for, is to get your questions answered. Thank you so much for having me out. Everyone should have two handouts. Our roadmap here, if you're a visual learner, this is awesome. We created it about 2 years ago, so it's a nice little cartoon map. Scratch all over it, write down your questions. I would like to review the information first before we get to questions at the end, because generally your question may be answered on the next slide or the next part of it. Our orange brochure here is for the SHINE program. So we are SHINE, stands for Serving Health Insurance Needs of Elders, and we are a dedicated network of volunteers that provide free, unbiased Medicare counseling. So I am not an insurance agent. We are not a coverage here to sell you anything. I'm here to tell you about how you can get to us when you have Medicare questions or concerns. We are responsible for Palm Beach and the Treasure Coast, which means Palm Beach, Martin, St. Lucie, Indian River, and Okeechobee County. However, on the back of the brochure, you'll see all the programs for the state of Florida. So if you know someone in Broward that might need some help, or up in the Panhandle that is complaining about their Medicare, might have some questions, that is the proper program to reach out to. So we are a national program. On the federal level, we are referred to as the SHIP program, State Health Insurance Program. Ohio is OSHIP, New York is HICAP, and I believe California is CaliCare, so sometimes we have to change our names because there may already be a SHIP program there. But if you do Google SHIP TA Center, you will find the different state programs if you have a loved one or a friend in a different place in the country. So we're going to go ahead and move forward on our Medicare basics. So I am not going to be changing any slides. This is exactly what you have in front of you, so I'm going to refer to it. If I put my larger presentation up, it'll take an hour and a half. So I could literally talk on Medicare for weeks, and I'm not going to do that to you. Please be patient with me. This is my 9th presentation this week, so if I get a little hoarse in the middle, it's annual enrollment period. It's the most wonderful time of the year. It's kind of our controlled chaos time. It began October 15th and it ends December 7th. And this is essentially the window where everyone in the nation that already has Medicare can look into their options for 2018. So we as SHINE volunteers were trained by Center for Medicare and Medicaid Services, as well as the Department of Elder Affairs in Tallahassee. We get all of the updates first. So we got all of our updates October 1st, so our counselors have been chewing on this information for quite a bit. So if you want to review anything or if you have any questions, please give us a call for an appointment. We do face-to-face and we do over the phone, so whichever would work better for you. I did check my scheduling system this morning, and we are booked out until the 3rd week of November. So we're getting to the finish line here, at least on our appointment side. We do open a wait list, but it's very difficult to play phone tag whenever you're on a wait list type situation. So if you are considering having an appointment, it would be best to call this afternoon. If you make an appointment, decide you don't want it and cancel it, that's fine too. But these things are going like hotcakes. So.
And what number do we call for that?
So on the back of your brochure, we are PSA 9, Planning and Service Area 9, Palm Beach and the Treasure Coast. Or on the bottom of your Medicare Basics handout, this is the state number, just down here. If you call in with a 561, 772, or 863 area code, you will get straight to us. If you have a different area code, maybe you've moved recently, then you will have to direct the system to PSA 9 Palm Beach and Treasure Coast. Eventually you'll get to us. It might take a few times, but that is the state number. I always like to give you the local number though. So it is by appointment only. If you show up at a site or my main office for an appointment without an appointment, my receptionist is as nice as she can be, but we won't be available. Clearly I'm out and about. Our main office is 45th Street in Congress. We are housed within the Area Agency on Aging. We have a satellite office in St. Lucie, but I have 19 different sites scattered out between the 5 counties, and I have 4 temporary sites right now, just for annual enrollment period, and I have 6 enrollment events going on. So October 16th was a Monday. I said to my husband and my kid, I'll see you on December 8th. And that's basically how it's been. Alrighty, so we'll get started on our Medicare basics. So original Medicare and Advantage plans. What in the world is the difference? There's A, there's B, there's N, there's F, there's this, there's that. There's so many different names to everything that has to do with Medicare, unfortunately. So we do need to understand that there are 2 separate paths. At no point on either of these paths do you ever give up your Medicare. That is the number one thing I hear, and I just cringe every time. I gave up my Medicare years ago. I'm on this HMO thing. You never give up your Medicare rights and considerations, ever. So I just want to make that clear before we move on. So original Medicare is your red, white, and blue Medicare card. So that is your Part A and your Part B. So Part A is hospitalization, or when you are admitted into the hospital. Generally, Part A is free for those who have 40 working quarters or 10 consecutive years or accounts with Social Security. So if
10 years with Social Security?
10 years or 40 quarters.
Okay.
Mm-hmm. So if you don't, let's say maybe you only have 20 quarters, it does work on a sliding scale. So if someone has no working quarters and wants to buy into Medicare, right now it's $419 a month. So that can get pretty hefty depending on how many quarters you may be missing. We can do that calculation if that's the case, but I have a feeling that everybody pretty much has all the working quarters they need to have it free. So again,
that 419 per month will be for A, B, and C?
just A. If you did not have the working quarters.
Be quiet. I'm speaking.
So 40 working quarters, 10 years with Social Security means you have it free. If you don't have the 40 working quarters, if you have any amount between 0 and 40, it's going to be a sliding scale from 0 to 419. And again, that's hospitalization. So that is when you are admitted into the hospital. Now your Part B is a different entitlement program on the same red, white, and blue Medicare card. So these are the entitlement programs. Part B is going to be your medical. This is your doctors. This is your emergency room when you are observed in the hospital. And your durable medical equipment, wheelchairs, walkers, some diabetic supplies and such. So these 2 pieces make up your red, white, and blue Medicare card. You will never see Part C on a red, white, and blue Medicare card, or D, or Medigap. So I read my blue. Also, we got news earlier this year that we are getting new Medicare ID numbers. Anyone know about that? Have you gotten that mail yet? Yeah. So so we're not going to have the Social Security numbers. They're going to be really fun looking. They will still be cardstock. They will not be laminated. They will not be like a credit card. And the reason for that is if you have certain processing systems, it can't read it, so it's still going to be cardstock. There is a very hefty debate right now. Can you laminate your Medicare card or can you not? It's kind of like your Social Security card and your birth certificate. You're not supposed to laminate it.
Right.
Oh. If the numbers are estrewed in any way, including some laminators, once you put it through, it's hard to read the numbers or the letters, then it's an invalid card. So the new Medicare card you'll start to get stuff in the mail in April, and essentially everyone will have their new Medicare card, new Medicare ID card as of April 2019. So that's only a year, so you'll be hearing a lot from us most likely. I may come do a whole nother presentation just on the new Medicare card because it's getting fun.
But they did also say that if you forget, your number, you can still use your Social Security number to get in.
You can. Just like if you don't have your insurance card, your regular dental or anything, and you go to the doctor, you can give them the social and they can call the plans network to find you by your social as well. So absolutely. It's just going to be safer. We're not walking around with our Social Security numbers anymore, and they're a little bit of a different identifier. if you have the 2018 Medicare and U book, if you do not and would like one, I brought a stack. The first page tells us all about it. Looks very similar, but you can tell a few differences.
Thank you.
So you're welcome. These are your A and your B. So that's your red, white, and blue Medicare card. Now, someone who is on the original Medicare path is actually going to have 3 separate cards for their insurance. They're going to have the red, white, and blue Medicare card, which is A and B. And then they have the option of additional coverage here, which is referred to as our Medigap or our supplement, and our Part D, which is for prescriptions. So, Part A and B cover 80% of Medicare approved services. That does not include, and I always make a dramatic example of like Botox. You're not going to get Botox on Medicare, or any of these kind of not medically necessary procedures or services. But whenever it is deemed Medicare service available, it is covered 80% by original Medicare A and B. Now, what do you do with the 20%? You can either pay out of pocket, cash, or you can take on a third-party insurance company, which is referred to as a Medigap or a supplement plan. And this is an additional premium every month that will provide help with the 20%.
That's that Blue Cross Blue Shield commercials we see all the time.
There are lots of different commercials.
Hey,
So
lucky lady.
I don't have cable for a reason. So but yes, so those are the commercials. Those are the inserts you're getting in the mail. Those are the weird phone calls you're getting. Probably hefty right now.
You said that A is free, and what about B?
I'm so sorry. B for 2018 as of right now. So we haven't gotten an update. There was a COLA, cost of living adjustment for Social Security of 3%, which equals about $20 a month. So generally when there's a COLA adjustment, there's a Medicare Part B premium adjustment. We have not gotten that yet. So we might be in the clear to no increase for 2018, but for right now it's $134 for newbies. So that means
Pardon me?
For what?
for $134 for Part B. $134 for Part B.
That's a month.
That's a month. And it can come directly out of your Social Security income, out of your Social Security check. Or if you're not taking your Social Security yet and you're still working but you're paying for Medicare, it'll come as a quarterly bill. Oh.
I got notified that they're taking $200 a month out of my
For
Social
your
Security for my Part B.
for your Part B. So that is what's called an IRMA surcharge. If you make more than a certain amount of money every year, then they will charge you a little bit more for your Part B premium.
But not reported.
So did you win the lottery, or are you taking out of a 401k, or you have any other income besides your Social Security? So this is what happened. Did you just retire? Did you just start
10
it?
years ago.
Okay, so we need to look at that. Because what happens is generally maybe someone was making X amount of money while they were working and they just retired, so it significantly changed. Well, Social Security doesn't know that, or Medicare doesn't know that, so we have to tell them, listen, I'm not making that amount anymore, I'm now retired, so I need to go. So we'll see. Making more retired, so.
Crying with 2 loaves under his arm.
So here's an example. My grandmother, it was a hairdresser. My grandfather was an exterminator, definitely within the $134 a month range. They won $250,000 on a $5 scratch off, so they got hit with IRMA, and they had to pay $350 a month both for their Part B premium because their income got that crazy influx for just that 1 year. So then the next year when they didn't win that, we had to tell Medicare, hey, we didn't win again. It's gone. So we can help you with that, or you can call Medicare directly. I wouldn't call Medicare right now because they're really busy, but we can do that with you. There's some paperwork to fill out. So.
The same price for everybody. Are you
Nope.
telling me it's not?
No, Part B is income. It is income based. It's income. Yeah, that's what they call it, IRMA.
It's a little surprise.
So yeah, it is. Yeah. That would make sense. Hurricane IRMA surcharge. So we're gonna hold some more questions. If you could write them down, I just want to make sure I get through everything, and then we'll address everything a little bit later. So Part A and Part B. So we were talking about supplement plans, which are, conveniently enough, named letters as well, so we get even more confused. What is a supplement A? What is a supplement F? You know, what is this G thing they're trying to throw at me? I'm going to leave the frame for just a moment so I can change to the chart of supplements. Now, supplements are third-party. Yeah, don't get scared with that one. I should have deleted that one. Okay, so this is your chart of Medigap plans. So you can see they go from A all the way till N, and they do skip a few letters for a good reason. So we have A, and you can find this on Medicare.gov. All of the information that we get, all of our plan finder tools, everything we use as counselors is on Medicare.gov. So if you're curious, you can go navigating that. So every part A has to cover the same. So you see some yeses and some nos here. We see Part A coinsurance, Part B coinsurance, that's at 20%. You'll see all of them say yes, but a few of them have percentages of that 20%. So every type has to cover the exact same thing for every company. So if company XYZ is offering you a type A for $100 a month, company ABC provides you the same type A for $150 a month, what you're paying for is a brand name or customer service. Every A covers the same thing. Every B, every C, and so on. So if you're paying more for a premium for one company than the other, it's maybe you recognize them, maybe you have a rapport with them, you like their customer service, you know. They all have to cover the exact same thing. So if you're interested in looking into Medigap supplements, we do these plan comparisons. And what we're going to do is we're going to go off of what you want. So we are an unbiased source. So if you're saying I'm budget minded, I need the cheapest thing I can find, be reassured you're going to get the same coverage as whoever is paying the most for that same type A. It's just you may not recognize the company's name. You know, it may be a little different. So
the same question probably for everybody, if you stay with Cigna, like I did when I retired, now that I'm on Medicare for the last year, how do I know what letter I am? I just haven't got anything, and I've asked them questions and you don't get all the answers.
Okay,
There's nobody
so
knows that you look for right
when
now.
it comes to the retiree coverage, every retiree coverage is different. And I was having this conversation earlier trying to pull the information before you guys got in here so I could give you a little better background. But what we're really going to have to do is sit down and look at your Cigna and see if it's considered like a secondary or if it's a supplement. So it's a secondary, it's not a supplement?
It's not a supplement, it's a complete
Okay, so it's a complete secondary. So as retiree, so that's exactly what it is.
So what letter would that be?
So it's not a supplement, it's a secondary. It's kind of like a third-party extra,
Is
so
that better than,
it depends. It depends on the procedure, depends on what's going on, so everything is very specific depending on the insurance. So, but we can look into that and we can look on both sides. So it's not going to be a supplement, it's a secondary. Some unions and some retiree plans offer a supplement, a Medicare supplement, but generally you have to pay an extra premium for them to be a supplement. So I know the New York Teachers Union does that. There's someone out in California that does that too. I only know that because we have folks that move here and come here with it. So I've seen it, I've touched it a few times, but not too many unions in Florida and all. So these are the different types. So you can see the most popular in South Florida is F. Oh, F is pretty full comprehensive. We got tons of yeses here, and then we have 80%, and then out-of-pocket limit. Only 2 of them have an out-of-pocket limit because they do the percentages. But you can see they even have an offering of 80% for foreign travel. So if that's important to you, if you do a lot of traveling, that may be important. However, if your entire family is in your county and you don't travel too much or anything, A may be attractive to you because it's the cheapest type and you might not move around too much. So, but the F, another thing that's happened lately, this is a very strategic agent move. There's word that F is going away. So I love hearing that. So we got confirmation that as of January 1st, 2020, F is no longer being sold. So that's 2020, we got a little ways. But if you currently have F, you are grandfathered in, you can stay. So, like type E, you don't see up here. Type E was F with prescription coverage. That didn't last too long because it was so comprehensive, someone just paid their premium and then they were set. I've only come across one person who had an E, and I told them, hold on to it as best you can. As long as you have it, you're grandfathered in. Oh, but some agents are misinformed and will say that it's going away completely. You need to change your type. That's not the case. You can be grandfathered into your F. So we use all the information from the Florida Office of Insurance Regulation to provide plan comparisons on these. I've seen a range from $60 all the way up to $980. So, and there is a reason for that, and I'll explain in just a second. I'm going to go back to the roadmap. Okay. All right, so we've covered our second card in our wallet if we have original Medicare. The third card is Part D, which is prescription coverage. It's another standalone company that provides prescription coverage for a certain formulary. The cheapest for 2018 is $17.70, and the most expensive is $169 and change. When it comes to Part D, you really get what you paid for, meaning the cheaper plans are going to have a smaller drug formulary. The more expensive are going to have a larger drug formulary. So what we do is instead of spitting out every drug formulary for you, we ask you for your prescriptions. We input them into the plan finder. And then when we pull up the plans, we can show you what's covered, what's not, how much it's going to be every month. If you ever touch that donut hole thing, we look at everything. So, and yes, I will go over the donut hole later. So again, original Medicare is 3 separate cards. So we're going to switch over to the Advantage plan side, which if you've gotten some letters, they're actually looking to drop the word Advantage and replace it with Health Plan. So Advantage is not going away. It wasn't a very well written letter. Got a lot of frantic calls about Advantage plans going away entirely. But they're just replacing the word with Health because they felt that it deterred some to that side when it wasn't actually an advantage for them. So Medicare health plans, or Part C. So this is a whole different part on its own, where you think of if someone's on a Part C Advantage plan, they have all of their services bundled into one third-party company. So this is your HMO, PPO, S&P networks. So an HMO is a smaller network. You think of an HMO more of like a county base. If you have an HMO for Palm Beach County, it's going to cover most providers in the network in Palm Beach County. So if you try to use it in the Panhandle, you might not have any luck. There may not be providers that will accept it. When you think of a PPO, you think of a larger network. So in South Florida, there are a lot of regional PPOs, which means that there's a lot of providers in the entire state that will accept the PPO. So we have seen for the first time this year, I don't have too much experience with it, but we have seen some closed PPOs. And that means that they do have a large network and they still can cover most of Florida. However, you'll need a referral for a specialist. So this is new to the game. We haven't had much touch with this, but they generally are a little cheaper than the regular PPOs. HMOs are generally cheaper as a premium than the PPOs because of that smaller network. So HMOs, PPOs, the Advantage Plan, Part C side, many do have an additional premium. So at this point, if you're taking on Part C, you're still paying your $134 for, if you have an armor charge, whatever amount that may be, for your Part B. And then you're paying an additional premium for this network. Some do offer free premium Advantage plans, like Humana Gold Plus. That's a popular one that has a 0 premium. So you have to remember when you're on the Part C Advantage plan side, you still have your Medicare rights and considerations. You are not giving up your Medicare. So an emergency happens, you're out of your network, you're out of the state of Florida, and you have to go to the hospital. You don't lose your Medicare. Your original Medicare is still enacted, so you would just give them your Social Security number. They would run through your original Medicare, and then you would be responsible for the 20%. So you're never completely out. Oh, yes, ma'am.
I just want to clarify something for our employees. Our HMO plan covers you in the state of Florida, and your PPO plan covers you in the entire country. That's how ours work.
With the Medicare or no,
regardless.
just general insurance, not the Medicare side.
Is she talking about general now?
No, she's talking about general now.
Every
General now.
So
And
PPO
it
is
models
out of state, HMO was only in Florida.
That's for, yeah, the Cigna, I guess it is.
Yeah.
The Cigna.
Oh, I didn't know that.
So, yep, and that's where the Advantage plan is attractive to some because it mimics an employee coverage in the network type of base. There are also networks called SNPs. They're special needs plans. So if someone is diagnosed with a certain condition, they can qualify for these special needs plans for that condition. It's a network of specialists specific to that condition. In Palm Beach County, we have diabetes, lung disease, heart disease, and COPD. So those are our special need plan for now. We're still rallying up for hopefully some more. But we're pretty attractive for pilots. We've got lots of folks as guinea pigs down here.
And what does it mean if you are someone?
So if you're diagnosed with diabetes and your provider, your doctor, will fill out the form for you, then you can submit it to Medicare and say, I would like to be considered for a special needs plan. They come in both HMO and PPO, and what it is it's supposed to streamline finding specialists for diabetes. So sometimes when you're in an HMO or a PPO network, there may not be many specialists for diabetes, but these special needs plans are specific to those conditions to help those with these conditions find providers easier. So it's worked out really great. So that's why we're hoping to get a few more conditions down here in South Florida. There's some others that struggle. So now in Palm Beach County, there are 3 Advantage plans that do not cover Part D. So this says most include. So that means in any given place there are about 16 that include, but there are a few that do not include Part D. So whenever you have an Advantage plan that does not include Part D, if you really want that network and you really want that plan, you're going to have to take out a separate Part D to work with that Advantage plan. But down here, you don't see that too often. Again, there's only about 3 plans that do not come with Part D. So essentially, you think of the Part C Advantage plan as a bundle. You know, Flo talks about, I'm going to save you money with your home and your motorcycle and your RV. Well, you think of Part C as the bundle. It's all 3 of those parts together in one company. So those with an Advantage plan or a Part C plan are going to have one card in their wallet. And that's what they're going to use to see the doctor, go to the hospital, and pick up prescriptions, is that one network card. So that's the separation between the 2 paths. Now, many think, so what if I try one side and I don't like it and I want to change? Or why in the world would I take this side if this side sounds so attractive? So the issue is, whenever you turn on your Part B, when your Part B goes active, whether it's because you turned 65 and you turned on Medicare, or maybe you postpone your Part B and you continued to work and you chose to turn on your Part B later in life. Whenever Part B goes active, it triggers something called a guaranteed issue rate. It's a 6-month window where supplements, Medigap plans, cannot consider anything to up your premium. So this is where you get you can't consider any of my pre-existing conditions, that I smoke 2 packs a day, that I live in a really high-risk zip code. I mean, these statistics for these Medigap premium calculations are, to me, very interesting, but they're very detailed. But during this 6-month window is when they can't consider any of it. They give it to you the absolute cheapest you can get it in your zip code. Now, yes, down here in South Florida, Medicaps can get really expensive really quick because there's a large risk ratio. There's a lot of Medicare beneficiaries in South Florida. If you move to Idaho, it'll be a lot cheaper, but you'll have maybe 1 or 2 options. Where down here, you saw the chart. For the chart, there's about 20 companies for each type down here. Not so much where there are not so many Medicare beneficiaries. It's very competitive down here. We're very attractive to insurance agencies. But then on the flip side, we're very attractive to providers. So it doesn't take much to find a provider down here that accepts Medicare. In other places in the country, it could be very difficult to find a doctor that does accept Medicare. So we get the good and the bad. So when can I enroll? Oh, generally, it's your 65th birthday. If you're taking your Social Security income, you will automatically receive your red, white, and blue Medicare card 3 months before your birthday. If you are not taking your Social Security income, maybe you're still working and you're postponing retirement, then you will have to voluntarily sign up for it for your 65th birthday. Oh, you'll have to let Medicare know you want it. However, if you don't and you want to postpone and push off that guaranteed issue rate, that Part B activation, you have to make sure that the coverage that you have while you are working is considered comparable coverage. It means that it's as good as or greater of a coverage than Medicare. Oh, and if there's any question about that, you can always call your plan and ask for a comparable coverage letter. Oh, and they will provide it. If they are not comparable coverage, they will tell you right on the phone that we are not comparable coverage to Medicare. If there is any time that you are eligible for Medicare, you're 65 or older, and you do not have comparable coverage, there is a penalty for every year that you go without Medicare and without comparable coverage. So that's where everyone starts to talk about the penalties, and it can get a little bit more. Sometimes I have some folks that come in and they say, I pay $172 a month for my Part B. That doesn't make sense. That's not an IRMA calculation. It's not a Part B regular payment. I don't understand this. Then we call Medicare and we find out that they went 2 years without comparable coverage, so then they had a penalty added on to their Part B premium. So if a friend or anyone you know has like a weird Part B calculation, it may be because they're paying a penalty. There is no way to appeal that. Oh, tried all we could, but.
I thought everyone needed to apply for Medicare, whether they needed it or not.
Okay, so you're approaching 65.
I passed.
Okay, and you want to, well, just an example.
You have to, but she's saying
Yeah.
instead of paying for it, you could.
So that's
use
Part
with
B.
forms.
But once I turned 66 and applied for Social Security, I got a Medicare card.
Yes,
Wasn't happy with the Social Security as big as they could be,
yeah.
but I'm not on Medicare yet because I still have Cigna insurance.
Do you have Part A? You turned on your Part A?
Well, that's what I signed up for.
Yeah, exactly.
I don't know
And
if
that's
I
just
have to
fine.
sign up.
Okay, so here's the thing. That guaranteed issue rate starts with your Part B activation.
Okay,
You can have A, it's free. Extra
I won't be
hospitalization?
penalized.
No,
okay.
not at all whatsoever. So they were thankfully smart about the guaranteed
Once I
issue rate
retire,
with B.
I will hook up on B.
If you turn on B, then you want to look at these. If you want to look at these, then that'll be the time to do it.
I'm on medication now, but I may be.
And that is why a lot of folks who are continuing to work postpone their B, because at 65, maybe they're not on any prescriptions. They see the doctor just for their annual. It seems just fine. And then when they go to retire at 70, maybe they have diabetes or high blood pressure or they have something else. But when they trigger that Part B, then it doesn't matter because they can't look at it. They have the guaranteed issue rate. So, and we do that. If you're approaching 65 or you just have questions, we do new to Medicare consultations. We look at, okay, if you continue to work, are you going to have this? Let's call them right now. Make sure it's comparable coverage. Can you delay this? You don't have to turn on your Part A. This is another thing I hear. I got my red, white, and blue Medicare card in the mail, but I'm still going to work, and they told me I have to turn on my Part A. You don't have to, but it is free. And it's an additional hospitalization insurance. So in a catastrophic event, it would be pretty neat to have the extra hospitalization insurance. But you do not have to. It won't affect your Social Security or your guaranteed issue rate. So.
Can I ask you something? Say we work for the sheriff's department, and now we go in the hospital, and they found out that you have Medicare A. So where does it come with the payment? Who's gonna pay it?
So an employee with 20 employees or more pays first, and then Medicare is secondary. So your Part A would be secondary.
I have Part A. Obviously, I'm still working. Next August, bye. I'm gone. They told me in the Shine office to come in 3 months before to sign up.
Yes.
Is that good enough?
Mhm. So if you are going to retire, you'll want to come in as early as 3 months before. You could do it the month before. I'll tell you right now, during the summer, you're going to get appointments. My volunteers are bored; they're chomping at the bit.
I had
So,
trouble
but
with-
right now,
they
yeah,
were
but
very
right
bad.
now we're really busy. But yes, so 3 months before, and it's 3 months before your 65th birthday. If you're considering turning it on for your 65th birthday, you can turn it on and choose your options as early as 3 months ahead of time, and it will go active on the first of your birth month. If you wait till a month, the initial enrollment period is the 7 months surrounding your 65th birthday. 3 months before, month of, 3 months after. If you wait till after, you will delay coverage. So there could be an amount of time that you don't have coverage. So come see us for your birthday.
I'm gonna be 69. I'm thinking about retiring maybe in January. I've been drawing Social Security since I was 66. So if I retire and I've got Part A and Part B, say I wanted to go to this Humana thing.
The Advantage Plan?
Would you recommend that if I were your father?
So I have to tell you.
Grandfather.
Okay, I'll tell you.
Grandfather.
I'll tell you two sides of this just because I'm recorded right now. One, my grandparents both have Humana. Two, I have seen the best and the absolute worst of every company. So I can't give a yay or nay for anything because I've seen as bad as improper billing for brain surgery, and then I've seen good cause reinstatement because a person has memory loss. I've seen wonderful things and horrible things on both sides.
But you
So
would recommend Humana for your own family?
now my grandparents don't let me do their Medicare plan comparison. If you'd believe it, my grandparents
We
don't.
won't talk
So.
about
So-
your father.
So it depends the Humana plan. It depends the prescriptions you're on. Depends on the zip code you live in.
Okay,
So-
I mean, really no prescriptions in
Yeah.
either shit. So would that mean that?
But here's the thing: there are different Humana plans for every zip code. So I'm not familiar with what Humana is available in your zip code. So that's why we do the plan comparison. So we put three, if you want it or not. We put three side by side, and we show you the good, the bad, and the ugly from all of them. So you'll want that.
The wise thing to do then, if I'm not on any prescriptions to speak of, and neither is she, is to not get the Part D, but then if something should happen to us that we needed
Now-
prescription, you could change over and get that at any given time.
So just like the Part B penalty, there is a Part D penalty. If there's any time that you were eligible for Part D Medicare and you did not take it, there's a penalty. So we need to look at those for you. So you'll want a personalized appointment for both you and wife. Will come in and look at everything because we also consider your doctors. So we ask you to call your doctors and see what they accept because you may be with a doctor you've had for 20 years and you absolutely love them. You don't want to go to anyone else. So we look at all of that. So you have to bring all that information in, but you'll want an appointment probably the middle to end of December.
Okay,
And then we'll
so
look into that for you.
If I decided to go with Humana, I heard that they kind of, you turn over your Social Security benefits to them and they, or your Medicare benefits to them.
So
And they do that, but do they, if you did trade that off, you're still paying $134 a month for Part B anyway, in spite of.
exactly. So they will take their premium out of your Social Security. They'll talk with Medicare on how to do that. But again, like I said earlier, and my number one point, you never lose your original Medicare rights and considerations. No, you cannot take a Part D on any time of the year. It's just during the annual enrollment period right now. So let's say you make this decision in January and you decide not to take a Part D, you're going to suffer a penalty all the way up until the next October, well actually the next January, because October to December decisions do not go active until January. So you have potentially 12 months of a penalty.
So what if I
So.
decided to take cheapest part of Part D, the $17 a month. Then all of a sudden I get hit with $2,000 a month in bills, and I say, okay, I want to switch up to the big one now. I'm getting penalized still.
You have to do it well, if you take out the $17 one, and you have coverage, so you won't have a penalty. You have coverage at that point.
But I can step up to a bigger plan.
Only during the annual enrollment period.
Like us, only child.
So basically, even whenever we do our personalized counseling assistance, it really is the best guess we can possibly do. Because unfortunately, I had someone that I counseled last year, my heart still goes out to him. We counseled in early December. He decided on his decision for his Part D. He went active January 1st. He had an event January 8th, and January 12th he went on this really crazy aggressive prescription, and it was super expensive. So what he decided December 5th essentially was a totally different game plan than what happened January 12th. And that's the risk. Everything is, it's all insurance, so it all still has
Do you
risk.
use
Hold on,
supplement
hold on, hold on.
insurance? Like, you know, like you're
There's other
saying.
people with their hands
Okay,
up.
yeah,
I
so,
did, I have it up.
It's okay.
okay, so,
She's had it up for a while,
Yeah.
sorry. And we only have till 1 o'clock, we wanna make sure that we
Mhm.
get
Thank you.
everyone's
Yeah.
questions.
so,
You said earlier Part B is based on income.
mhm.
Do you know where the cutoff is, what amount of income before
So
it
again, this
increases?
hasn't changed yet. It may change
But
because of the
approximate?
COLA increase. But I know that the very initial level is $84,000 as an individual. And I'm so sorry, but I do not remember the threshold for a couple.
Okay,
So, but you can find all of it on Medicare.gov. You just type
Okay.
in IRMA
okay.
and it'll come right out. It'll come right up. Not the hurricane. The
And that's your last year of service?
last year of working, yes.
And
But
then-
if it changes, so
Right.
let's say you were making 95 and then you went into retirement and you're only making, I don't know, something dramatic, 30, then you just have to prove to Social Security and Medicare of that change, which is easy to do. You can use your Social Security amount checks. You can use, anything like that. Just prove that it's going to be different, like dramatically less or under that threshold, and then you won't get the IRMA surcharge.
Thank you very much.
Mhm. And we can help with that paperwork too. We do it pretty
To
often.
answer Michael, I stayed with, I retired 10 years ago. I stayed with Cigna and went on Medicare January 1. Since I've been with Medicare and Cigna as my supplement, I assume that's what it is.
Secondary.
Yeah,
Secondary.
secondary. I really haven't paid anything. Go to your doctor, I don't get any bills.
And you go with who?
I kept my
How
Cigna.
much is your
We can talk about
Yeah,
that
we can
on
use the-
one-on-one. You
yeah.
and I can talk about that.
Yeah.
I can give you rates.
So you had a question. Go ahead.
I forgot now.
Oh, okay. Oh, I'm sorry.
Are you
So-
HMO?
Huh?
No,
I
POS.
forgot,
Yeah.
interrupted me, I
I'm
forgot.
sorry.
That's all right.
Sorry.
I didn't have
So-
a hand up high enough.
Yeah. So other than the Medicare basics, there are financial assistance programs. So one of them is it's called Extra Help or the Low Income Subsidy. And this is monitored, managed, determined by the Social Security Administration. That is a federal program. And what that does is if someone qualifies, they will get assistance with their Part D. They will get help with their premium, potentially their copay or co-insurances on prescriptions, and they will completely jump that donut hole thing, which we'll talk about in a minute. Now, for an individual, for Extra Help, again, this may change here in the next few months. It generally changes every 3 months, and I haven't gotten an update since April, so we'll see. But for an individual, the gross income per month is $1,450. For a couple, gross income before anything's taken out is $1,991. Now this is just prescription here as well. Now whenever someone is on Extra Help, they're getting that financial assistance program. It triggers something called a special enrollment period where they can change plans and consider different plan options all year round. But only if you have the Extra Help. Now, for the state of Florida, we have a partial Medicaid program, which is on the other side of the low income opportunity. It's called the Medicare Savings Program, MSP. It is monitored, managed, and determined by the Department of Children and Families. So, very confusing that a Medicare program by Department of Children and Families, but that is the managing entity. So what the Medicare Savings Program can do, depending on the level that someone qualifies for, they can help with the Part B premium. So it would essentially be the state of Florida paying the Part B premium for this individual. Oh, it may also, if they qualify for the lowest level, help with co-pays, co-insurances, and assist in that manner. Now, the limits for the Medicare Savings Program for an individual are lower than the federal poverty level because it is a state-determined program. And this program I refer to as my black and white program. You make it, you don't, you don't. The Extra Help program, I've seen someone as much as $100 over that income limit still get it. Can't explain why. Maybe federal, but state of Florida, we have so many Medicare beneficiaries. In the state of Florida, we do not have the system to support it. So the income for an individual for MSP is $1,335 gross per month, and for a couple is $1,825. All right, so the financial assistance programs on that. So it's very difficult for me to explain the donut hole, but I'm going to try my best without a visual. So we don't have a cartoon on that yet. But basically, the donut hole works like this. So whenever you begin your coverage January 1st, you're starting in what's called your deductible period. So up until a certain deductible, you are paying 100% as the beneficiary. For 2018, the maximum deductible is $405. You may be on a Part D plan that does not have any deductible. That is the plan's choice. However, they cannot charge you more than $405 as a deductible. I see some middle ground sometimes too, like $180, $240, but they cannot charge more than $405. Once you reach that deductible, you move into your initial coverage period. That is when the insurance pays 75% and the beneficiary pays 25% of the prescription cost. Once everyone's contributions, both your deductible and your initial period at 25% and the insurance is 75%, reaches $3,750 in total, that starts the donut hole, or in insurance jargon, the coverage gap. Now, during this coverage gap, you are paying, it used to be in 2014, 100% of the prescription cost, but when the Affordable Care Act went into play, they started to make the manufacturers a little more responsible for a discount. So in 2018, you're going to get a discount of, I believe it's 56% for a brand name, and 48% for a generic. So you're not paying the full 100, but it can still be pricey in this donut hole depending on the prescriptions you're on. So, once a beneficiary spends $5,000 out of pocket during this coverage gap, during this donut hole, that's when you reach the other sugary side, which is referred to as the catastrophic level. So you've reached the other side of the coverage gap, and the insurance is jumping back in, and you're paying $8.35 for a brand name or $3.35 for a generic until the rest of the year. And the donut hole situation starts again every January 1st. So when someone is in the donut hole, we can help. There are coupons, there are prescription assistance programs, there are manufacturing programs that we can help anyone to find and apply for. A coupon cannot be used on top of insurance. So you cannot run it through your insurance and then use the coupon on top of it. You have to ask for the cash price and then use the coupon. So most times with the coupon situation, it ends up being pretty close in price, sometimes a little different. But whenever you're using these assistance programs and the coupons, they are not contributing towards that $5,000 to get you to the other side of the donut hole. So there are advantages and disadvantages, and we go over all of that all year round. So we get a lot of those calls around May, June, in the middle of the year when everyone's approaching that donut hole. So these are your Medicare basics. But essentially the biggest thing, if you take anything away from today, are two things. one, you never lose your Medicare rights and considerations, ever, ever, ever. And two, please call us. I have 52 wonderful retired volunteers that provide their time. And if you think I know what I'm talking about, they have more time than I do to research and to really dive into this stuff. So please use our guys. They're amazing. They come from all walks of life. Also, whenever you get to retirement, you might find out after a few months you're a little bored. I'm always looking for volunteers as well. So we train from January to July, and I'm always open for that as well.
I went twice, as I told you before, to the one where I live in Hilltown. Guys, you gotta go on a one-on-one. The things you hear out on the street, forget about it. Just go talk to a counselor. They answered, I went twice, they answered everything I needed
For
to know.
Medicare.
So can I come to you?
The Shine.
Can I come to you?
No,
Yeah, and you can
because I needed to ask her a question when I came in.
and you
that I
use
didn't understand.
use
But
us
they're
as many
great.
times. You
They're
can have as
great.
many appointments as you want. We're
Yeah.
free, we're unbiased. I mean, definitely during the summer months we're really slow. So. So that's my spiel. Thank you guys so much for coming out. I hope it was helpful. Thank you.
Thank you.